we're going to go ahead and get started so that our presenter has enough time to share information that she has as well as answer any questions. Today we have the honor of having, go back, Nina Weiler Harwell from AARP. She's going to be sharing a presentation for us on caring for California's 4.4 million caregivers. So I'll hand it over to Nina.
So good morning, everybody. Actually, pleasure to be with you again. I was with you and I did present on caregiving at, I believe, the Inland Empire's Aging Action Plan launch meeting, which should have been the fall of 24. So great to see many of you again. I'm going to just start by saying, you see this number 4.4 million? We're going to bounce back and be forth between that and another number, 7 million. Whenever you see this number, this will pertain to individuals caring for somebody 18 and over. And then there's other data in caregiving in the US, which pertains to people who are those who are caring for people of all ages, including disabled children. Next slide, please. So let's start off with a quote from the wonderful late, great Rosalind Carter. She once said, there are only 4 kinds of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who themselves will need caregivers. And I'm going to suspect that a lot of people in the room can relate to this. So I will just ask you to raise your hand if any of these terms applies to you. Have you been a caregiver? You can just use your raise hand feature. Are you currently caregiving? Do you think you will be a caregiver? And do you think you'll need caregiving? And I can tell you personally, they all apply to me. So I've been a caregiver myself for my mother. I'm currently caregiving for a son with autism and a husband who's disabled and still working. And I know I'm going to need a caregiver. So with that, I'll move us on to the next slide. So let's begin with some key data, and we're going to begin with national data. So according to Caregiving in the US, which came out last year, 60 million Americans are family caregivers. So that's about more than 1 in 6 Americans. And this report actually came out last July, and you can see the citation on the slide. This report actually was first conducted in 1997 and is considered one of the most authoritative data sources on family caregivers in the United States. This is the 6th report. They tend to come out every 5 years or so. So let's now get into who are our family caregivers. And according to Caregiving in the US, again, 63 million family caregivers. This actually says 1 in 4 adults, which makes sense. 61% are women, 39% are men. So it seems like that 60-40 split that I know I've seen over many years pretty much maintains, where women are definitely providing the bulk of care. The average age of a family caregiver is 51. That's gone up a bit. It was 49, I believe, in the last report, but nearly half are under 50. So that's actually younger than many would expect, or not, because I think a lot of times when you think about when your caregiving responsibilities would have started, if you had aging parents, it would have probably been in your 30s or 40s where you had to start caregiving, and that does make sense. There's also a growing cohort of younger caregivers. So about 25% of people that are millennials are already caregiving. We also know from the data, and you can see this on here, 29% are sandwich generation caregivers. So having to balance responsibilities of raising children while also caring for an adult family member. Nearly 20%, or nearly 1 in 5, 18% actually already have a disability on their own. And 27% are caring for somebody with cognitive dementia or cognitive impairment. And that is definitely the most common diagnosis I will see when I'm talking to members or members of the public in terms of their caregiving responsibilities. And as you all know, that is extremely challenging. Next slide, please. Okay. So let's start with who are our family caregivers and how we define this. And maybe you know this, but this again is an adult providing ongoing care over this past year to a family member or friend. And they're going to assist with activities of daily living, shopping, transportation, meal preparation, and other tasks that are going to help loved ones remain in their homes and communities where we know they want to be. They also are really, in addition to the activities of daily living, they will also often be providing medical and nursing tasks. That is also in itself very challenging. That includes managing medications, providing wound care, assisting somebody with, say, their diabetes management, tube feeding, and you name it. But these are also individuals that provide care coordination, arrange appointments, monitor their care recipient's condition, and really are the communicators and advocates with their health providers as well as their service providers. Next slide, please. So on here, we know why we should care about family caregivers, but here's the thing, and I think I've already said this. This care, the ability for people to remain in their homes and communities would be impossible if not for the care provided by family members. And when we talk about family members, we're not just talking about mom, dad, spouse. We're talking about extended family and friends as well. So I had previously noted a number of 4.4 million family caregivers. That number is for people, again, caring for somebody who's 18 and over. The caregiving in the US study pertains to, again, caregivers of people of all ages. So in California, nearly a quarter of California is actually nearly a quarter of adults in California are actually already providing care to a family member, a friend, and they've done this in the past year. And again, without that support, people would be forced into nursing homes, which most of us, quite frankly, could not afford. There are hundreds of thousands of dollars a year if you're private paid. And without that support, we would see governments, both federal and state, having to spend a lot more money on these long-term supports and services. So thanks to everybody. We also know, and this is a different data point from the Caregiving Out-of-Pocket Cost Study from 2021, that the typical family caregiver who does provide financial support pays over $7,200 a year to cover the cost of a loved one's care. That's $600 a month, which I couldn't even imagine having just bought a new home. We also know that we have, of course, an increasingly older adult population. That's why you all are here, right? And that means we're going to have people also living longer in poorer health, and combined with a long-standing shortage of direct care workers, which doesn't seem to be getting much better. We're creating a situation that puts even more pressure than ever on family caregivers. And if they are going to continue to be the backbone of our long-term care system, they have to be provided with recognition, resources, and support that they need to do their critical work. Next slide, please. So now we're going to dive in, and this is really where caregiving in the US has so much value, because it's very specifically getting into the challenges faced by family caregivers. We know that they're already balancing caregiving obligations with other obligations that could include working, Actually, the vast majority of caregivers are actually still employed. And of course, may also be caring for young children. On top of that, they face budget strains because of the high out-of-pocket costs for caregiving. And of course, it is physically and emotionally draining. And now we're going to dive a bit deeper into those challenges. Next slide, please. So about half of all family caregivers, just under, have experienced at least one negative financial impact due to their care responsibilities. And this includes they've halted being able to save. They've used up personal short-term savings. They had to take on more debt. They left bills unpaid or paid late. And about 17% had to borrow money from family and friends. We also know, and this really brings into question the equity issue the equity challenges that we continue to struggle with. Certain populations are more likely to experience negative financial impacts. And that's especially true of people in Black communities, Latino communities, and those who are lower income, as well as younger caregivers who, of course, aren't earning as much. I had already talked about this a bit, but just to highlight that the caregiving out-of-pocket cost study, and we'll put these in chat when we can. 78 or more than 3/4 are already caregivers are spending out of pocket to care for their loved ones. And that is, again, an average. This is a national average of over $7,200 a year out of their own money for caregiving expenses each year. Next slide, please. So now we're going to talk a bit about the duration of care and the hours of care provided each week. Caregiving is pretty much a full-time job. So a quarter of caregivers provide 40 hours of care or more each week. And 35% provide about more than 20 hours. The average duration is 5.5 years, 5.5 years, and nearly 30% of caregivers will provide care for 5 years or more. And that's actually an increase from 24% shown in the 2015 studies. We've also done, AARP has actually done polling ahead of elections. We really talked to family caregivers and women, because it's actually called She's the Difference. Women voters are a higher propensity, but these studies have also found that nearly 1 in 4 voters, men and women, identified time commitment as their biggest challenge. So imagine working 40 hours a week and then either going to your home or your parents' home or your friend's home to care for a loved one for another 20 hours. It's exhausting, right? So we also know that caregiving, because of the demographic imperative, the demographic changes, caregiving is growing in scope, intensity, and complexity. And this is driven, again, by not only demographic changes, but technological and healthcare challenges. We know it is really imperative that lawmakers understand the vital role of caregivers in our health and social systems. And it's really important to address these challenges and needs. Because I will just tell you, as somebody that does a lot of my work in the Capitol, I've seen a sea change over there in the last 10 years. Because it used to be that not everyone really understood the critical strains brought on by family caregiving. Well, now folks are all getting it. A lot of them are sandwich generations. They themselves are caring for an aging parent. And so we actually see that in the Capitol, which actually helps our work. Because now people understand the significant role that caregivers play in actually reducing the cost of care provided by the state. Moving on to the next slide. With me. So let's now get to working caregivers. An astounding 70% of caregivers, working age caregivers, are actually employed while also caregiving. And 6 in 10, 60% of those folks are actually working full-time hours. And balancing work and care responsibilities really puts a significant strain on people. Half of these caregivers actually experience work impacts, so they have to arrive late, leave early, take off time to meet caregiving obligations, request telecommuting flexibility is another one. These workers, despite the fact that they're working, are actually cite that they are feeling isolated. So that was about a quarter of people nationally that told the folks running the survey. They feel isolated. They don't feel like they have help. Of course, they also face the negative financial impacts, such as taking on more debt and leaving bills unpaid. We also know that access to caregiver-friendly workplace benefits has improved. Now, talking nationally, we've seen more and more states expand workplace leave programs, and California has done a great job in that way, but access remains uneven. So while in California, you can take up to 8 weeks of paid family leave if you are working to care for a loved one, but say my friend in Alabama who was caring for my uncle, she would have no access to paid leave though. So it would have to all be done on her off time, or she'd have to give up, either go part-time, turn down a promotion, retire early, lose various benefits, take a leave of absence, unpaid. There is the federal medical and family leave benefit, but that only applies to larger firms, 50 and more, and it's unpaid. So that doesn't help folks in some of the states where workplace leave policies have not expanded. In addition, again, bringing back equity issues, people who are working in salaried positions enjoy far better access to telecommuting, paid leave, and employee assistance programs than hourly workers. So also, about half say they do not, more than half say they actually have not told their supervisor that they are also family caregiving. So that certainly adds to the sense of isolation, lack of support, and also a fear that identifying as a family caregiver could damage one's career or other prospects within wherever you are working. Next slide. So again, taking us back to caregivers assisting with activities of daily living. These are all listed on the slide. I believe I had already listed off some of them. The truth is that most caregivers receive very little training. So your loved one comes home from a hospital, you need to transfer them in and out of their bed and chair. You don't do it correctly, or you already have a week back, and there goes your back, right? Certainly a lot of these tasks are physically and emotionally challenging. So as we've seen, training is really lacking, and this study found that only 11% of caregivers have received formal training to assist with the activities of daily living. So as well as what we call instrumental tasks of daily living, and that would things like grocery shopping, managing finances, preparing meals, helping with transportation. In addition, because we have an aging population, just over a fifth of family caregivers actually received any formal training on medical and nursing tasks. And I previously in the presentation talked about some of the challenging tasks that actually come home with a loved one when they come out of the hospital. It's not just, transferring somebody in and out of their bed or helping them with toileting. It can be managing medications, properly applying eye drops, also helping with tube feeding. So these are really challenging, and I believe AARP still has some videos up about, they're very frank. I'm going to go find them in a little bit. I will put that in the chat. We had some videos from the Home Alone study that actually provides some tips on how to manage some of these medical tasks. I will also, I'm going to preview the next topic. California in 2015, passed a law called the Hospital and Family Caregiver Law. It's called the CARE Act in other states. 40 states have already passed this. It was an AARP model bill. And what it requires hospitals to do is, when someone is being discharged, and even before they're discharged, they have to identify the family caregiver, the willing family caregiver. And they're supposed to be providing them with training on any of the tasks that come home with them. I'm going to suspect that some of the application of this law is uneven, that not everybody is getting this training. So you're sent home and your loved one has an eye infection. And you have to apply eye drops. And you have to do it the correct way, right? So they, spread the infection or worsen the infection. And a lot of caregivers are simply not getting assistance on any of this. So we can talk about that a bit during Q&A. I'm going to move us on to one of my favorite topics, which is policies to support family caregivers. As I said earlier, I am actually a state lobbyist. So I represent AARP, our members and their families, right across the street in the state capitol. And so a lot of my time is spent on caregiving legislation, not all. I do other things that are ancillary to caregiving, such as telehealth, healthcare, and so forth. But we're going to really talk about how some of the challenges that face working caregivers, and also what are some of the resources that older adults and people of all ages can use to plan for their future. So let's dive right into, next slide, please, some of the caregiving solutions that are available in some parts of the country. So first of all, something that AARP has been fighting for at the national level is a caregiver tax credit. And we've actually been introducing this every single session, but unfortunately it doesn't really, it's been difficult to pass. We know that caregivers told caregiving in the US, this would really be helpful. There's been actually 5 attempts here in California that AARP tried, but it's an expensive policy and we've not been successful. We also encourage programs where caregivers can be paid, can either be paid or at least receive some reimbursement for the hours they provide care. Well, California has in-home supportive services. The person receiving care has to be low income, but not the person providing care. And I check the data constantly. So over 70% of care providers in IHSS, in-home supportive services, are in fact family members. And this includes friends as well. Also, so that's such an important program. It now covers over 800,000 people. And I think when I looked at the data, there was recently something like 400,000 family caregivers. That's incredible. And while it is a minimum wage position, it can make the difference between someone having to quit work entirely or being paid to provide assistance with activities of daily living to their loved one. Another critical policy change that can help those caring for loved ones is really a partially paid leave of absence from work for caregivers who are employed. And California already provides a pretty generous paid family leave program. So you can actually take up to 8 weeks of paid family leave. You have to be working full or part-time to care for somebody who has a significant medical issue. It has to be approved by a doctor or nurse practitioner, but we do have that program. And we've actually expanded this program so that it also includes, say, chosen family. That's your extended family. I want to go back a bit to the income tax credit to caregivers. So the federal law that we've been trying to pay, and these are typically non-refundable, I just want to make that clear, would cover up to $5,000 in costs, but we haven't been successful. Interestingly, 2 states that have actually been successful are Oklahoma and Nebraska. It's a non-refundable caregiver tax credit of up to $2,000 and $3,000 if the care recipient is a veteran or has dementia. We are doing our best to try to improve this particular legislation and policy in California. So I guess I'll move us on to the next slide. Okay, next slide. So in addition, we know that challenge is a time. So it's really important to increase access to respite care, as I know some of our partners on this call know very well. Respite care is care that can be provided to a care recipient so that their family member can actually get a break. It's widely cited as a helpful support to caregivers. So I know that the caregiver resource centers assist with respite care. There are other types of respite, such as adult day services. One does have to be low income to qualify for that program here in California, but there's that. The PACE program, the program for all-inclusive care for the elderly, can basically take in somebody 55 and over who's dual eligible, and bring them into a center or facility or some kind of enrichment activity for part of the day so that the caregiver can get some respite from their care responsibilities. So in this study, we saw that 40% or nearly 40% said that respite services would be very helpful. But unfortunately, only 13% use respite services. And that's a constant challenge in the state trying to expand respite services, not just for people, say, who qualify for Medi-Cal or whose care recipient, but for programs that really help the so-called forgotten middle, like our caregiver resource centers. Bless you all. Other work, there's also various practical barriers to respite use. Sometimes they face inflexible program design. They may not have trained providers. That's not the case with our partners, of course. Cumbersome application processes. And among some people, there's a lack of trust. There's shame about handing off care to somebody else. And they're not certain about the quality of care. We do believe that local governments, state and local governments, must work to provide improved knowledge of available respite services and address barriers that prevent them from using the service. And that barrier can include just government funding, state funding for these programs. So among caregivers that Caregiving the US spoke to, 86% of caregivers who actually use respite services said it was extremely helpful. And 42% said it was the most useful, helpful service they received. When we've actually spoken to family caregivers as part of some caregiving town halls that AARP has done, and we're speaking to people in community, and Carmen, I know you know this well, we will typically hear from people, I need a break. So this is such a critical service, and it is definitely it's underutilized because the resources aren't really there to expand it to more individuals. And what does that mean when I can't or you cannot access that care? you're paying $7,200 out of pocket a year on average to find some kind of program where your loved one can actually go somewhere, socialize, receive food, receive some care, and that caregiver can get a break. Next slide, please. So I'm going to talk a bit about workplace policies that support family caregivers, and I've already talked about this a little bit. Even though caregivers in this study said that they generally feel supported at work, but as we saw, only 49% say they've actually told their bosses that this is a role they play. So I'm not really sure how they would be feeling supported since they don't feel comfortable sharing that information. But we do encourage, let me just say that typically in a workplace, benefit could include a flexible work schedule. This is caregiving employee resource group is another. So some places do offer employee resource groups where you can gather with other people in a similar situation. Some provide assistance programs. Some will let you know, about 25% will allow you to telework. And here, in addition to paid family leave and the Federal Medical and Family Leave Act, some employers will provide paid leave. So actually, I'm very fortunate. AARP does provide up to 40 hours a week for paid leave, 100% salary. We actually use that before we go to paid family leave. Typically, the most used benefits would be a flexible work schedule, using vacation as sick leave, which is less than ideal, right? We would hope that people would be able to use some kind of paid time off and not use up their vacation and sick leave, which they actually need to get a break. Expanded unpaid leave. And again, people will tend to use employee resource groups if available. And this slide also lists some of the most helpful benefits. I will tell you, as somebody who cares for, it's been a while now. Our son is almost 24. I can't believe it. But when he was diagnosed with autism, when he was just over 2 years old, AARP was incredibly generous because we were able to receive, and we know California is very generous in this regard, ABA therapy in the home. So he started preschool in the home with trained providers, and I was able to telework. And this was in the 2000s. So I teleworked 2 to 3 days a week while he received that care. And then my husband also took up a lot of the responsibility. But we really do encourage individual workplaces to implement some of these policies, again, to really help our growing number of family caregivers support their loved ones, feel supported, and do the best they can to keep their loved ones out of costly institutional care. We also encourage state and local governments to offer these benefits. And of course, we encourage states and localities to not just provide paid family leave, but paid sick leave, which can be used to help somebody. If you're caring for somebody who's ill, you can actually, in California, use paid sick leave for that care. And that was a big deal, for example, during the pandemic, right? People could actually access paid sick leave, and they could actually take some of that time to care for somebody who was ill. And again, we encourage this. I think there's a few cities in the state that provide that support, including Berkeley and Los Angeles. But I can't tell you right here now that I have the full list. Next slide, please. So finally, training and support. I touched on this earlier with California's Hospital and Family Leave Act. And we know that caregiving in the US found that a third of caregivers said it would be really great if a doctor, nurse, or social worker asked what you needed to help care for your care recipient and required that you ask that a doctor, nurse, or social worker ask you about what you need to care for yourself. And a lot of times that just doesn't happen. A couple of years ago, just as a personal story, my husband got extremely ill. He had RSV that was so significant, he was in the hospital for a week. We both got it. That was a really fun winter. But either way, I will just tell you that when we were discharged from the hospital, I don't think I received any instructions on how to use. He needed to use some tools to help with his breathing because, of course, he had shortness of breath. My husband happens to be a nurse, so he knew how to do it. But if he didn't, I would have been at a loss. Well, you can go online, but if you really want to learn from an online video, probably not. We also really encourage federal and state governments to offer a range of culturally appropriate services to meet the needs of an increasingly diverse cadre of family caregivers. Caregiver assessments. We have been trying to get the state to a point where we get to a uniform caregiver assessment that really evidence-based caregiver assessment to help improve targeting of supportive services, training programs, support programs, family members, and family meetings and counseling. And of course, we support the creation of education and training programs to help to ensure that caregivers have the training they need to properly manage their loved one's condition. They should be prepared and taught how to perform long-term supports and services, including not just medical therapy, but as I said earlier, transferring, bathing, dressing. I had already talked about the hospital and family caregiver law. Most states call it the Caregiver Advise, Record, and Enable Act, or CARE Act. And actually, I said 40 before. It's actually 43 states and Washington, D.C. And this, again, the hospital is supposed to identify the family caregiver upon admission. They're supposed to record this. They have to notify the family caregiver of discharge plans, and they have to be offered training. And again, as I've already said, this is not evenly applied, but you should all know that this is actually the law in California. And since we'll have a little time, I'm happy to link our care. We actually have a card you can download, you can look at online to just remind you of what the law requires in California. AARP, I'm going to go to the next slide, please. Provides a wide range of family caregiving resources. These are free. You do not have to pay a dime. We have statewide caregiving resource guides. So I actually am the person that curates that every year. So it includes a variety of partners from Alzheimer's, in-home supportive services, or caregiver resource centers, which I told you we just adore. There's various resources available, sometimes through your local area agency on aging. I believe that usually applies to people who are low income. We have various articles and resources in Spanish and English. We have prepare to care guides that you can download. They are available in English, I believe simplified Chinese, and Spanish. And we also tailor some of the guides to specific communities, including Latino community, as well as LGBTQ plus and veterans. We have a Facebook page. We have, the instructional videos. There they are. I was just talking about them. So since this is recorded and when we're done, maybe we can put some of these links in chat. You can look at some of these Home Alone Alliance videos if you really want to dive into the proper way to provide care for a loved one. They, again, are very frank. They're not going to gloss over the realities of what you're going to be facing with. We have a community resource finder that we actually built with the Alzheimer's Association, and we have various webinars that you can find online. We actually started creating the state caregiver resource guides maybe 10 years ago, and they're a very popular tool. So again, if you go to the resource guides, you'll look up California or any state. If you're caring for someone in Arkansas, or New York, you can find that as well. And you can find those tools and support. These are not going, they're not ward handoffs, so it's going to give you phone numbers and websites. Next slide. And we are now at Q&A. So I am here to take any questions and really support as much as I can those here who are family caregivers. So again, here to take Q&A. Are people raising their hands?
Hi, Nina. This is Carmen. Thank you again for this wonderful presentation. I think a lot of the information, well, for me, resonates, obviously. And it's just so alarming to see all these statistics on the amount of caregivers, the financial strain, the time commitment, um, as well as the increase in working caregivers. And so I did have one question for you. That you mentioned the CARE Act. Is there any monitoring going on with the CARE Act, or who monitors it to make sure that hospitals are providing or identifying the caregiver and then offering the appropriate training?
So the agency that is providing oversight to hospitals is the Department of Public Health. And there are actually local satellite offices for the Department of Public Health in the state, but it's Department of Public Health. And right now, I would say this is something that will require some research to see. I know back when this was launched, we were talking to some hospitals and they were saying, yes, we are in fact implementing this, but certainly some work needs to be done to make sure that this is still among the critical items that inspectors evaluate when going through their annual reviews of hospitals.
Yeah, because I can, from personal experience, I'm also a caregiver, a caregiver for my son. Um, and I think, when you're a caregiver and you're in the hospital with them for a week or for a long period of time, all you want to do is get home, right? So you forget, or you don't forget, but you're so anxious to get home, you kind of just let them breeze through the discharge. But then you get home and you're like, how am I supposed to do this again? And so I think it's definitely is important to get that word out more for caregivers on the CARE Act, and downloading the cards specifically, and sharing them with people that you know so that they know when they're going to be, hospitalized, or, that they know what should happen, because you can forget. It's so easy to forget. I think we have a question from Tracy. Tracy?
Carmen. This is Tracy from the Office on Aging, and I am interested to hear about that CARE Act. We have, with Riverside County, we have an Office on Aging, a AAA employee that works is stationed at the county hospital at Riverside at RUHS, and she's doing the evidence-based Dr. Coleman CTI transition care transitions intervention model there. And that is kind of addresses this. It initially set out years ago to be with primarily with the patient to, when they go home, we see them at bedside and then we do a follow-up visit at home and find out what, fill in any knowledge gaps and make sure they can get back to their doctor, their follow-up physician after discharge. And did they get equipment they need? Do they know how to use it? What medication, all of that. But in recent years, we've been expanding that to the family caregivers because we know a lot of patients do go home, just like what Carmen said. The patient's super anxious to get home, and they might hear all the instructions but not retain much of it. So, or we've got, like in the situation, patients that are in the hospital that have dementia, but they might be being treated for something else, and then when they get home, it is the family caregiver who is going to be doing all of the follow-up with the doctors and the medications and all of that. So we are doing that there. I'm going to follow up with my employee that's at the county hospital to see if a lot of the referrals, if that might be a way to get more referrals, if they realize that, hey, this is a law where you need to be providing some education and support. And that's another way we could augment that for them. So thank you.
Well, you know what? I'm glad you raised this because what I'd like to do is collaborate, and, try to figure out how much, like, well, I would start with the Department of Public Health, which is literally right across the street. But, finding out what are they actually finding in their surveys? Is this actually being implemented? How many hospitals are doing it or not doing it? But let's move forward together because I have to admit that's something even at this point, I'm not even sure how much that's being checked and it needs to be checked. It's absolutely essential. And like I said, it was actually, let me go back to two winters ago, the winter from it was actually my son who had to provide the care because I had RSV. So it was Kaiser, South Sacramento, like, nope, stay away. And I don't think he got any instructions. But like I said, my husband may have also declined it because he's a nurse. But I don't think probably wasn't offered. Elizabeth had her hand raised.
Yeah, this conversation is very interesting, especially concerning caregiver support at the hospitals and transitioning out of hospital care. I think about my dad was recently in the hospital too, and we had to fiercely advocate for more than one person to be in the room because my mom was the primary caregiver, trying to synthesize all this information. And like it was such a fight to be able to get other family members in there, which was crazy. And then at the same time, so you receive the care, they were let go, and now they're at home receiving care, and they have like a question, a nuanced question. And the only way to get the nuanced question answered was to follow up with their physician. And when you follow up with your physician, sometimes that's a 3-month wait period, even if it's an urgent situation. So it's 3 months of, I hope I'm doing this right because nobody at the hospital can tell me and I can't follow up with the physician. So fingers crossed. I think figuring out like a gap or some sort of stopgap would be really interesting, or if there already is something that exists, being able to better promote that.
Yeah, and I'll also say sometimes it's the caseworker or the person discharging you or a nurse that could do that. So typically it may not be the doctor, be an RN who would come and provide that support. So you raised some really important points, and I'm putting this on my list to think about for next year. What do we do? The work would start this year, but how do we ensure that it's actually happening? And it just sounds like it's not really happening, at least in your case. Or the other issue too is what if there's more than one family caregiver, right? And I cannot recall if the law specified one family caregiver. Carmen, I'll get back to you. It was a Hannah Beth Jackson bill from 2015. I know it doesn't mean anything to you. But I have to go look at that again to see if it says a caregiver or more than one, because it's often a family affair, right?
Yeah. There's another question in the chat from Victoria. What resources are available to prepare the home for care?
That's a great question. So I'm just writing down my last note. So in terms of, and Carmen, maybe you can help with this question too. Preparing the home, AARP does provide a resource called, why am I blanking on the name? We actually do provide a training on how individuals can prepare their home for long-term supports and services. So we do have that. And I have to go find actually find it. I know we actually do presentations often online or in community, helping people to set the house up for an aging individual. So this kind of thing, really making those home modifications should happen ahead of time, right? We actually, in our new home that we just bought, we actually do have, we've got a whole bunch of grab bars. We had appropriate stairs put in because my husband is disabled. And so we just made sure he had what he needed. While we're here, let me look up the exact name of the program. I apologize, and I will put that in chat. So that's one way. And I don't know if anybody else here has some.
Sure. Well, Victoria, that's a really good question. And if you're not currently providing care, the earlier you start looking into the resources is certainly available. I know at Inland Caregiver Resource Center, we get a lot of calls from clients who are already in the middle of caregiving. But sometimes we don't recognize we're caregivers. So my question to you, Victoria, is, are you already providing some form of care to someone? It doesn't have to be 24-hour hands-on care. And you can become a client within the Caregiver Resource Center, and with the help of a family consultant, they can help you navigate that. How can I prepare my home for care, right? Um, every situation is different. So I have a lot of different follow-up questions for you, Victoria, but which would be better, like in the form of an intake, obviously. But are you talking about providing care in the future, about providing care now, about someone being discharged from the hospital? What is the diagnosis of the patient, right? So that we can see what kind of tools you may need in the home to care for them. So definitely it's important to think about these ahead of time, and so that's great. And to connect with organizations like Inland Caregiver Resource Center, AARP, Alzheimer's Association, Riverside Office on Aging, San Bernardino Department of Aging and Adult Services. So there definitely is a lot of resources. The important thing is for you to get connected to those resources so you can start that process in planning. So certainly, Janelli has put in the chat AARP's information, and I'll go ahead and put Inland Caregiver Resource Center its information. But yeah, this is all pertinent. And like I said, a lot of times we don't start planning until we're in the middle of it, and things get very overwhelming very fast. So the sooner we start thinking about it, if you don't identify yourself as a caregiver now, like Nina said at the beginning of the presentation, that Rosalind Carter quote, we're going to be a caregiver at some point. So it is important to start looking into the different resources now, instead of like when it's happening. And if you're interested in helping us navigate some of these issues, that are being presented here locally in the Inland Empire, you can join our caregiving / Alzheimer's and other related dementias action team. And so I'll turn it over to Elizabeth, who can share a little bit more about our action teams so that you can get involved in some of these things.
Awesome. Do we have the slides, Janelli? So
Yeah,
we
give me
can
just
share the times with everyone of these action teams. So one of the big initiatives of the Inland Coalition on Aging is the Master Plan for Aging and implementing this Master Plan for Aging. And to do that implementation and also to advocate and to bring light and to target in on these really important topics that came out in our needs assessment and this Master Plan for Aging, we have action teams. And these action teams do work across one another, but they also work to target and move forward specific initiatives with concerns to their topics. So we have a transportation action team, meets the second Tuesday of the month from 10:30 to 11:30. We have the housing action team, which is really involved and active and a really cool group of stakeholders within the community who are moving initiatives forward. That meets the second Tuesday of the month, 9 to 10. We have the Caregiving, Alzheimer's, and Dementias Action Team. A few of you I sent actually notes to inviting you to join the action team. If you got my note, feel free to respond to the email, but otherwise you can respond here and we'll make sure that you get on that invite list for the calendar invite. And that's the second Wednesday of the month from 11 to noon. That team focuses on long-term services and supports. They focus on Alzheimer's and dementias and all aspects of caregiving. So if you're interested in that, we really encourage you to come out. We also have behavioral health and social support, which meets the third Tuesday of the month from 1:30 to 2:30. And we have safety, respect, and equity, meets the second Tuesday of the month from 4:30 or 3 to 4. And then we have the advocacy action team. And this is one that is more recently started. That meets the second Friday of the month from 10 to 11. And going into the next couple months, we're going to be focusing on our long-term services and supports advocacy day, which happens at the beginning of May. And so we encourage you to come and get involved in the advocacy action team. But if you are not able to be involved, just keep an eye out for an email that may be coming from myself or Carmen or from this email address listed below. And we may be asking you to either recommend clients or people who are receiving long-term services and supports and various community supports to come and advocate at a state level with us and to share their stories with policymakers. So we really want to encourage you to keep an eye out for that, even if you're not able to participate in our Friday advocacy action teams. These action teams are open to all interested participants. We are focusing on people who are driving initiatives within their communities in Riverside and San Bernardino. We have people from government represented. We have people from the offices on aging in both counties represented, and nonprofits too. So we have a real diverse group of participants across all of these action teams. If you're interested in participating, let me know which one you're interested in participating in, or just send me an email and I can direct you maybe towards one that's the best fit at info@inlandaging.org. We also have leadership roles that are still available with a couple of them, specifically our advocacy action team. And we are looking for a chair to help shape the next steps forward. I'm helping with all of these, supporting the initiative. So if you do decide to join and step up into a leadership role, just know you won't be alone. I'll be there supporting you and guiding you through the process. And so will our Inland Empire Master Plan for Aging. That's all nicely laid out. That helps us guide us through this process too. So an invitation to come and join and participate. We'd love to see you there.
Right. Thank you, Elizabeth. And thank you again, Nina, for wonderful presentation and information. We know AARP is a strong partner in all aging related matters, and so we appreciate that support and partnership. So please, a round of applause for Nina. And our next meeting will be Tuesday, March 24th, from 11 a.m. to 12 p.m. We will have Dr. Sandra Espinoza. She is with Alliant International University, the Los Angeles campus, and she will be presenting on practice guidelines for providers supporting clients impacted by ICE raids and deportability. So that is going to also be a very interesting presentation that we encourage you to join us on March 24th. Thank you, everyone, and have a wonderful rest of the week.
Thanks for having me.